Dear students, we start our lecture. Today, I'm sorry, you must wait. Today, I have information about our course, full information. And finally, we will have 9 lectures. All material include in lecture form of education, of course, of bioethics. And after that, we must have a credit, and credit we will have in our portal AEOS. And I hope you have a login and passport of this portal. Who doesn't search this, please find this information. Try to work in this structure. It's not hard to understand how we work in portal. At the substance of our credit, we have a test. Test include, I think it may be 20 questions, simple questions of our course. Of all information you will hear on lecture, I put attention on keyword of our lecture. We remember the main point of this on last our lecture, and all students who come to classes doesn't have any problem with our course and with credit. Yeah. Please be attentively on this information. Yeah, I see that some students come to classes. I'm sorry you must wait. And we start our material today. 1 minute. I open presentation. Today we have not a big topic, and we try to think together with this term. And hard knowledge of this lecture include some phrase of this, but understanding of this term must be more fully and more light happens. Some problem with the internet. Please, students, type in chat. Do you see a screen? Everything is normal. And we start. Yeah, okay. I see your feedback. And the topic of our lecture today is ethical questions. I pay some time to remember about our previous speech about conversation with historic fact, the reason of born of bioethics, and we talk about 3 main reasons of born of bioethics. Yeah, and finally I tell that this discipline doesn't have only one right answer in our practice. Yeah, what doctor must do in this situation when we have, for example, new methods of therapy, but doesn't have any license background of these methods in this country, for example. Or we must learn some, we must teach some treat, sorry, we must treat some kind of patients, and who is the first, who is the next. For example, in a pandemic situation, it's then be very actual situation in all countries. And in these cases, we have some questions, and our mind find the answer of questions. What I must do, why, where, how, and these questions lay on our knowledge of our picture of world. Yeah, and this structure, it's not only medical information. It's include our mention our intelligence, our cultural background of doctors, and it's I hope you remember that it's not only medical square of working, yeah, and bioethics, it's a cross of philosophy, culture, legally, and other area of government, some kind of this type, and questions, and what we think about this. Yeah, we separate some kind of these questions in our lecture today. Yeah, you see a definition of bioethic. We finish our previous lecture of this, and we start our classes today on this definition. Okay, and I try to describe this information of this slide, where we must understand what the common character of questions in ethical field. Yeah, you see that very often these questions, ethical questions, include. Sorry, I want to point on a classification, yeah, of questions. Ethical questions, it's a first kind of questions in bioethics. Yeah, okay, write this. First type of questions, it's ethical questions. Yeah, what the characteristics of this type of questions? Yeah, its type questions include word with must, should, earth, and other words of these questions. What doctor must do in this situation? Yeah. And in the answer of these questions, we have not only one decision. Yeah? Its situation, there are several alternative solutions in this situation. And very often it's consists of some challenging, you see, and problem with working. Yeah. And the next characteristic of this type of questions is moral choice. These questions include moral choice or dilemmas, yeah, in this situation. Yeah. And the most kind of characteristic is answer of this question. On ethic question, we doesn't give only one right answer. And if specialists said that it's a right decision in this situation, it's not a right answer in ethic situation, because all side of these questions have a substance to discuss. Yeah, have a field to dialogue. Yeah. Ethical questions, for example, yeah, you see on slide some example of ethical questions. Yeah. At first, you see its problem named euthanasia. If you doesn't hear this term, please write this and find some information. Euthanasia. Should doctors provide fatal medicines to terminally ill patients who want to end their own lives? Okay. Euthanasia. Our discipline, it's very interesting and not hard discipline, and we may learning and funny learning. In our classes and lectures, I tell about some information in internet, in YouTube. On previous cope, you hear that we may search information of thalidomide strategy in internet, and of problem of euthanasia. You may watch a great film. I don't know its right translation on English, because in film it's maybe not same definition in Russian. It film names something like that. Nobody know Jack. Yeah, nobody know Jack. With Jack Nicholson in this film, and you may see this film on this problem. The next ethical questions: should scientists clone pets or animals for food? Okay. It's very frequently touch problem when we have ecological mention, when today we see the pressure of this structure on government, on some factories, for example, on your meals in shops. We see that these products doesn't took any rubbish structure on our meals. It's pressure of our government, and the reason of this, it's ecological mention on our world, and in this year it's a main problem from the government, all countries all the world. And problem of cows, it's big problem, because they produce many CO2, carboxygen, and it's not good for our environment. And today we have technology when we may produce these meals in laboratory. Yeah? And what we must do with this? Yeah? May we eat these meals? What kind of problem we have with this? Yeah? How these clone pets indigestion in our organism? What kind of fails in our genome may be in future will be take some problem of this. It's questions, it's open questions today, and we doesn't said that it's yes or no answer on these questions. The next example of ethical questions: how should doctors distribute scare flu vaccines? It's contemporary situation, and last time we have this problem, we talk about this. Yeah? Whom should science test new medicine on? It's important question. And of thalidomide strategy, we tell about this. We telling in that Grünenthal company, pharmacological company, doesn't produce any experiment in laboratory. And today, and the next position of bioethics, next historic fact that we have experiment from men in Nazi clinic in the time of World War II in Germany. Yeah? And it's two field we must experimentate it in our practice, and we have some morality problem whom of these experimentists. Yeah? It's some example of ethical questions, and please look on this slide, and I give you a few minutes to read, and we at the next we come to this slide and try to find some kind of questions. Yeah. At this time, look on this slide and try to separate ethical kind of questions. Okay, our flow include many students. Oh, I see 67 participants in our lecture. Yeah? And we may try to type answer in our chat. It's some difficulties, yeah. And look on this kind of questions, yeah. And we try to separate ethical problem of this ethical type of questions. Да? D. Look on D. Yeah, D. It's ethical questions. Okay? Should individuals who donate a kidney choose who their organ should go to? Yeah? It's my kidney, and I want to give my kidney from only these children, for example, with kidney failure. But my kidney maybe doesn't have this characteristic to work in this body, and may I this opinion in this situation? It's ethical questions. Yeah, it's ethical question. And the G questions, yeah, you see, should people select the sex of their child in advance? Yeah. It's very actual situation in China, for example, yes, where in country we have a cultural aspect and the born of girls, it's happiness in family, and boys, it's not a good situation. Yeah, and if we have a technical aspect to give this opportunity to marriages people, it's ethical problem. Yeah, okay. Finally, we talk about ethical kind of questions in bioethics. Yeah? The next type of question, it's legal questions. Yeah? It's simple to understanding. Legal questions ask what the law says about a particular issue. Yeah? On only this type, in this time, in this country, what write in this document, in laws. Yeah? It's legal questions. Yeah? And in practice, we see some gap of these two structures. In law, in legally, we must do on this way. On an ethic situation, we want to do another way. And what a right decision in this situation? We must think about this and take decision. Yeah. Okay. Look on this kind of questions and try to find a legal type of questions. Let's look at this. Yes, I see your answer in chat. It's good. Please, it's interactive, some interactive variant. It's good. And on this time, you may type in chat your opinion. What kind of law questions. And on the body of question you see legal. Yes, A. Is it legal to sell human kidneys in the United States? Yeah. In this definition you see legal. It's maybe morality or not morality, but in one country we have this opportunity to sell some organ to transplantation, and in other country it's not legally. Yeah. Okay. And please, on your tests in credit, we see the same questions in test. Yeah? And when we find the right information, we doesn't think about the right answer, yeah, of these questions. It's legal in United States or not? I don't know, and it's not a main idea of this practice. Yeah, we separate type of questions. It's legal questions. Yeah, what's the problem of transplantation in this country? Yeah, it's legal questions. and you see a F answer. Yes, yes, I see F in your chat. Yeah, is killing someone always illegal? Yeah? In our country, it's always illegal. In China, for example, yeah, not in only it's illegal. Yeah, and it's lower type of questions legacy on structure. Yeah, and H. Yeah, I see right answer in chat. Yeah, constitutional. You see this word in questions. Are same-sex marriages constitutional? Yeah, in this country, in this time. Yeah. Okay. Yes, yes, yes. We give right answer on this test. Next type of questions. Right, this it's scientific questions. Scientific questions. Very often it's divided with ethic, with legality. Yeah, and what is it? Scientific questions. Yeah? Scientists, it's a man who interested how the world working, how in medicine, how our body working, how on this body, what kind of action do some medicine in our body. It's scientific area. And in medicine, the answer on scientific questions we give with observation and experimentation. Yeah? And medical doctors doesn't speak from self opinion. Our opinion lay on some baseline of evidence, yeah, of experiment, of trials, yeah, and it's a trend in our branch in medicine, medicine based on evidence. Yeah, I tell something in previous lecture about FDA and its structure. See only on this information when this new molecular, new pills come to examination in this structure. Yeah. And scientists, it's a hero of this process. Yeah. And please find a scientific question in our slide. It's not hard. Yes, I see right answer in chat. Yeah, I see right answer. Yeah, what type of diet? Always for a best athletic performance. Yeah, it's scientific questions. We must have an experiment. Yeah, all this. Why we doesn't underline this variant? Yeah, I E, okay, B, yes, I see your answer. Yes, B, it's right answer. How does a kidney function inside the body? It's scientific areas how this organ working. Yeah, okay. And next type of question, it's religious and cultural questions. Oh, it's very important only in your auditory, yeah, because we start to practice from focus. We come to clinic and see a Russian patient, and we have some cultural особенности, да, particularities. And on the practice, we understand that it's not right views when we see on cultural aspect, yeah, but it's some problem when we try to modify behavioral of the patient, for example. Yes, at time we talk about this. Yeah, religion and cultural question. Ask what would be in line with a particular beliefs or practice, or the common practice of a particular culture. Yeah, culture. And I tell one example in in my practice. Yeah, I was born not in Ulyanovsk, yeah, in another city of Russia. And when I come in Ulyanovsk city, I doesn't have a have a contact with another religious in my practice. And when from my working one patient woman come to me with paranja, I don't know in English, yeah, and I something understand that it's Muslim woman, and she said about some problem with back pain and with headache, pain in neck, and I give some questions. I talk about the history of these diseases, and you understand that after that I must examine my patient, and I tell, please take on your clothes. And I see big eyes on this woman. She said that you are a man. I said standard phrase about I am not man, I am a doctor. I must examine your body from some problem with muscle. I must find this information to give a right diagnosis from you and separate only right treatment. And I have some difficulties with this patient, and you may have some aspect in your practice because cultural, religious, maybe more wire, more difficulty that we think about this. Yeah. In our slide, you find these questions. Yeah. In body of questions, you see religion. What does my religion say about where or not it is acceptable to donate a kidney, yeah, for example. And in practice, we have more difficulties with this situation. I tell about some examples, some famous examples, some great example of this, and one of this in my picture of what I touch with this situation. I not a big fan of Bob Marley. Maybe some of us like this music, but when I like to read about life of great people, scientists, great musician, and when I read about Bob Marley, I search some interesting fact about the reason of death of Bob Marley. I understand that most of us who understand what the artist I describe, we may think about some problem with pills and another additions of this thing. But I very interested when I read this. The reason of death of Bob Marley not a chemical structure. It's not right some problem с наркотиками, да? And it's interesting. In 5 course of oncology, we learn about melanoma. It's very dangerous disease, oncology. It's cancer of skin, and the one character of this cancer, it's very quickly grows. And the time it's a first what we must think when we see a problem with skin, some point of skin, we must think about melanoma and put exam of this piece of skin. And when Bob Marley find this problem in a 5 finger on a leg, and the doctor diagnoses it's melanoma, and the next point of this, we must treat it and we must amputate this phalange, 5 phalange on the leg. But Bob Marley, it's have a religious. He create a new religious, yeah. По-русски это называется сафаритяне, как-то так. Safarian, in English, it's some branch of Hinduism, and Bob Marley thinks that our mind is very difficult structure. Our mind work and continue work, and sometimes we think very hard. We very smart. We very. This structure is very difficult from our personality, and all people must stop this process of our brain from some chemical structure. It's a substance of religious of Bob Marley, yes, Safaritianство. And another aspect of this religion is that it's the same with Hinduism. Yeah? Our body must be common, and amputation in Indian religion, yeah, it's big problem from a mind, from psyche of person, because when we reincarnate in another life from this religion, our body doesn't feel good in next living. Yeah? And Bob Marley very hard think about this, what we must do. He was come to Germany in good clinic, and all doctors who communicate with Bob Marley doesn't come to a right decision in this situation. In our next classes, we talk about some aspect of agreement, yeah, in medicine, and when patient said that I doesn't do this, we doesn't have any power to do this action, but we understand that it's only one right decision. We must amputate this phalange and continue the life of this citizen. But in this situation, it's not be realized, and Bob Marley was die from cancer of skin. It's example how we have a problem with religious, with cultural in our practice. And next type of questions, it's last type of questions, it's personal preference questions. You see in slide this, personal preference. Its questions relate directly to the speaker and often modified by cultural bias. Yeah. Sometimes we may ask what you prefer, yeah, in our treatment, for example, and very often doctor must do some modification of cultural bias in practice. Yeah? In our slide, you see an example of this is joke. Joke questions. Yeah, do kidneys taste good? I don't know. Yeah. And in practice, in medical practice, we think about some aspect. And when, for example, in my practice, when I see a clinical situation, some case, and I may try this treatment, and another treatment may be the same effect of this. And in this situation, I may ask questions from my patient and say what we prefer. We may try this treatment or another. What you prefer? It's personal preference. In our country, for example, many people think that injection therapy more effectively than tablets. And when I see not acute situation, for example, in neurology practice, low back pain, for example, very frequently situation, and I see not acute, I ask this, we may start on injection of treatment or tablet variant. What do you prefer? And it's personal preference. Yeah? What kind of this tablet? Or it's a sachet form, or tablet or capsule. It's personal preference. You understand that it's the same. It's a different way to transfer this chemical structure, these drugs in the body, and it's only personal preference situation. Okay, and pharmacological company understand this, and from one type of customers, it's injection, tablet, capsules, some another variant, yeah, some пластырь, я не знаю, как по-английски, да, там trans-skin structure of a therapy, for example. It's personal aspect of personal preference of our patients, yeah, and in this kind of questions we have a high field to fantasy in our practice. It's some colors of our practice, because it's not boring when we describe only one pills in practice. Yeah, we have a field to scientist творчество, да, какое-то в практике. Окей. And in we have 10 minutes. Yeah, I think it's it will be your home task. Yes. But we doesn't have a practice, yeah. Okay. I describe. You may screen this scenario. It's the same. It's a joke when we create this slide. When we find this information in our cathedra, we think that it's fantasy. Some flu vaccine, some very frequently death, some dangerous all over the world. It's not be possible. But start COVID and we have a problem of this. You see that it describes the same situation, and in practice it's a very dangerous flu. Many people die, and scientists create a vaccine, and some doctors on practice have eight have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 10 patients, and only 4 doses of vaccine. Yeah? Look on this category of citizens, of patients, and in practice we look on this situation and doctor must separate and answer two questions: who should receive the vaccine and why. We separate only this patient, and who doesn't have vaccination and have a high risk of death in pandemic world. Okay? And you may think about this, screen this category, think about this, And we have a classic approach to the answer of these questions. Yeah, you see this, you underlined on these five approaches. Yeah, and you may screen this this approach and what we used in your thinking. Yeah, we have some questions from this aspect. Yeah, you see that maybe some questions from this personality. You see this aspect. Yeah. You may screen this. Yeah. In our mother case, patient, all of this, yeah, 47, 16 years old, да. And doctor, we may see about clinical doctor, it's maybe podiatrist, yeah. And this aspect of cases, the woman who thinks she is pregnant has been married to the elderly for about a year. They have no children. It's maybe, yeah, your dreamer of this situation. And she said about this, but doctor must think about and create some right decision, some opinion in this situation. And in conclusion, we of our lecture and of this case, I demonstrate on this case that in practice very often we touch with ethical aspect in our practice. My friend who work in я не знаю, как сказать по-английски, чтобы вы поняли. I don't know in English that you understand how this works in our country. For example, in the chief of cardiologic of Ulyanovsk region, for example, the chief doctor in this area must separate patients to very expensive operation on the Moscow center, clinical center, to this operation on the heart, and he must separate this. And all day, one day a week, they come to this commission and have very hard decision in this situation. Who is the first, who is the next? Yeah. If Ivanov first, yeah, the Petrov maybe die, and it's only in practice questions, yeah. And you in practice you think about this. Sometimes it's difficult, and right decision, it's this decision what we find in this situation. Yeah? But live with this feeling all your professional life. It's not simple simple way. You see this same that in slide that I said. Okay, and dear students, I see 67 participants from 300 students on our flow. Yeah. I tell at once that at the finale of our course we have a credit, we have a test on portal, and on this testing I create your credit in your course. Yeah. Today we talk about 5 types of questions. Yeah, it's ethical questions, laws questions, scientific questions, religious and cultural questions, and personal preference questions. Yeah. In test we have some variant of this type of questions, and we must separate right type of questions in your test. Okay, I think it's not difficulty to you, and I hope that we have a good dialogue. Thank you for your attention. Goodbye. Our next lecture. Our next lecture. I open our schedule. Yeah. Oh, Friday, 8 a.m. Bioaetics. Yeah. 28th of January. Okay, our next lesson. Thank you, dear students. I see your smile.